So let's talk about the nerve innervation to the ear. And when I'm talking about innervation to the ear, I'm not talking about the special sensory information in terms of hearing and balance, which is conveyed through our 8th cranial nerve or the vestibular cochlea. I'm actually talking about the general sensory information that's carried from the middle and external ear, that's responsible for conveying our sense of touch and pain. So why is this important clinically? Well, ear pain or otalgia can actually be due to a number of non-otological causes. That is, pathology in structures that have nothing to do with the ear can sometimes cause pain to be referred to or felt in the region of the ear. And there is actually quite a variety of different conditions or pathologies that can refer pain to the ear, including red flags for certain types of quite worrying pathologies like head and neck cancers. So to understand why pathology in head and neck structures can refer to the ear, we have to look at what nerves are carrying general sensory information from this region of our body. And when we come to look at the nerve innervation in relation to the ear, particularly the middle ear cavity and the external ear, we find that there's actually quite a number of different nerves that are contributing to carrying sensory information. These particular nerves also have a key role in innervating other deeper structures within the head and neck region. And like in other instances of referred pain, the brain can misinterpret signals that arise via nerves associated with deeper tissue structures. For example, if there is inflammation or irritation within those deeper tissue structures. And when those signals come into the central nervous system from those nerves, the brain confuses those signals as arising instead from the skin or specific areas of the skin that are innervated by the same nerves. And the brain interprets those signals as pain arising from that skin region. Now, the ear is no exception. So let's start in the middle ear cavity and work our way out laterally and introduce the different nerves that are contributing to carrying general sensory information. At the level of the middle ear cavity, the lining of the middle ear cavity and the medial side of the tympanic membrane is supplied by the 9th cranial nerve or the glossopharyngeal nerve, specifically a branch called the tympanic nerve. As we move out laterally and come to the external ear, remembering that the external ear consists of the lateral surface of the tympanic membrane, the external auditory meatus or ear canal, and the pinna itself. Now, there's quite a few nerves that contribute to carrying general sensory information from the external ear. If we focus on the lateral aspect of the tympanic membrane and ear canal, then we have 2 cranial nerves carrying information from those parts of the ear. And that includes the trigeminal nerve and the vagus nerve. When we come out to the level of the pinna, the vagus nerve and trigeminal nerve are also responsible for carrying areas of sensation from that particular part of the external ear. But we also have a contribution from the branches with cervical spinal nerve roots from C2 and C3. Now on this image here, this is just to demonstrate really that we have that contribution from several different nerves in relation to the pinna. So we have the auriculotemporal nerve, which is effectively a branch from our trigeminal nerve, knowing that also elements of that will be carrying information from the external auditory meatus as well, so going much deeper into the external ear. The concha, or the sort of deepest part of the pinna, is contributed to by the vagus nerve, and then this most lateral aspect of the pinna has branches that are derived from the 2nd and 3rd cervical spinal nerve roots. So we have a number of nerves here that are contributing to carrying sensory information from the pinna and the full extent of the external ear. We know that these cranial nerves and these nerve roots also supply other structures. So, for example, in relation to the glossopharyngeal and the vagus nerve, we know that they're carrying or innervating parts of the pharynx and the larynx, and therefore pathology involving that part of the body can actually sometimes refer to pain being felt in the region of the ear. Similarly, with the trigeminal nerve, or a branch of the trigeminal nerve, innervates the temporomandibular joint. So it's not unusual for sometimes pathology in the temporomandibular joint to be referred and felt in the region of the ear. And finally, these cervical branches, C2, C3, and the branch derivatives of those spinal nerve roots will supply structures within the neck, such as the vertebrae, or the joints between the vertebrae. And so sometimes pain or pathology involving the vertebrae can actually be referred and felt in the region of the ear. Finally, just to add that the external ear also has a contribution from a branch derived from the facial nerve. Now, this is important because you will come across a type of facial nerve lesion or palsy known as Ramsay Hunt Syndrome. And Ramsay Hunt Syndrome presents with a unilateral facial droop involving the whole half of the face, with the presence of vesicles that are found in and around the ear, specifically the external ear. And the reason that those vesicles arise is because in Ramsay Hunt Syndrome, that is a reactivation of the varicella zoster virus, which has lied dormant within the geniculate ganglion of the facial nerve. And when that virus is reactivated, we get involvement of the facial nerve in terms of the facial droop, but we see manifestation of that reactivation via the presence of vesicles on the skin. And because we have a contribution of the facial nerve to the skin of the external ear, that is where those vesicles will manifest. So let's sum things up. Otalgia is a very common presenting complaint, but it's important to be aware that not all otalgia is due to a primary ear pathology. Now, while in most cases otalgia will be due to a primary ear pathology, for example due to acute otitis media or otitis externa, the clinical examination of the ear will be typically abnormal and the history will strongly indicate that that's the cause. However, if ear examination is normal and the history doesn't suggest a primary ear pathology, we have to think that that otalgia could be due to referred pain from non-otological disease. Now, the general sensory innervation of the ear, the external and the middle ear, is really quite unique and complex, and it's provided by 6 different nerves, as we've introduced. And that includes branches from the cervical plexus and also 4 different cranial nerves. So pathology in any structure that's supplied by those nerves can present with otalgia. Now, commonly, those causes would include, for example, temporomandibular joint disorders, pharyngitis, or dental disease. In some instances, it can be due to head and neck cancer, so otalgia could potentially be a red flag. So diagnosing the cause for otalgia in the absence of primary ear pathology can be quite challenging because of that varied innervation of the ear. But if you understand the number of nerves or the different nerves that are innervating the ear, then it will help you to further direct the sorts of questions that you might need to ask in your history and your clinical examination if you're considering non-otological causes for otalgia.